Health care is a human right, not a privilege.
Yes.
And together we are going to end the international embarrassment of the United States of America, our great country, being the only major nation on earth not to guarantee health care to all as a right.
That is right, Bernie. Preach, brother, preach. Yes, I absolutely love it. Bernie Sanders came out with his he reintroduced his Medicare for All bill. He updated it. He added some things that were missing after Jayapal. I keep forgetting what her first name is, but after she came up with her Medicare for All Act, which is very comprehensive and is phenomenal. And I honestly, at this point, I am leaning more towards her. But as when we just talking about the candidates, Bernie Sanders is by far the strongest. He's been a Medicare for All proponent the longest. So I am most definitely for Bernie, and everything he added to this bill is nearly exactly like Premier Jayapal's Medicare for All Act, except for the way it's going to, except for the transition period. I think Bernie's is 4 years versus the Jayapal's, which is 2 years. But let me give you just a rundown of what the Medicare for All bill is and what it's going to provide, and then we'll jump back to Bernie Sanders so he can tell you the details and why it's so important that we have Medicare for All. Goal for this Medicare for All bill is for every person living in the United States has guaranteed access to healthcare with comprehensive coverage and benefits. That is indeed the goal. So the comprehensive benefits, and let me tell you, let me just go down the list. It's 1,000,001 things. It's what is involved in all of healthcare. All you healthcare providers out there, all you nurses out there, understand that all of these things are necessary when it comes to insurance, when it comes to healthcare, right? So the legislation provides comprehensive healthcare coverage, including all primary care, hospital and outpatient services, dental, vision, audiology, women's reproductive health services, maternity and newborn care, long-term services, and supports prescription drugs, mental health and substance abuse treatment, laboratory and diagnostic services, ambulatory services, and more. I say and more because I try to read Bernie Sanders' bill. So anyone that tells you that this thing is not thought out is out of their mind, because his bill is 100 pages long. I went through it. I sift through it. There's 1,000,001 things, and it tells you there's many ways he puts in the bill as to how they plan to pay for this, right? So that is another video, because it's going to, there's 1,000,000 ways. It's very comprehensive. It's thought out to the T. Dotting the I's, crossing the T's. Is that the saying? Yes, but he did it all. He did it fantastically. The link to the bill will be in the description box below if you want to sift through it. It is a long read. It is difficult to go through, but he has thought of everything. But let me have you just listen to him just a little bit more so he can explain the why that this is so important that we have Medicare for All right now.
The American people are increasingly clear. They want a health care system that guarantees health care to all Americans as a right. They want a health care system which will lower health care costs and save them money. They want a health care system which will guarantee them freedom of choice in terms of the doctor or hospital they go to. They want a health care system which will substantially lower the cost of prescription drugs. They want a health care system which will finally give senior citizens the benefits they need for dental care, for hearing aids, and for eyeglasses.
And that last part, when he talked about the elderly citizens and long-term care specifically, those are the two things that he added. So if you didn't know that, he put this bill out last year, right? And then he added all these extra things that were desperately needed, one of which was the long-term care for the elderly. And specifically says long-term services and supports for people with disabilities and older Americans will be fully covered by Medicare for All program. And last but not least, the transition period will be 4 years. And of course, it's very important that I know 4 years might sound like a long time, and that's an entire term for a president, but it's necessary. We're going from a private insurance way of living here in America to a single-payer Medicare for All system. That transition needs to be perfect. Everyone remembers when the ACA came out, when Obamacare came out, and the website didn't work the way it was supposed to work, and the whole world flipped over and thought it was the craziest thing because it crashed that first day. They don't want that to happen. They want the transition to be seamless. They don't want any hiccups in the problem, because when there's hiccup when it comes to your healthcare, that's not a hiccup. That could be your life. So the 4-year transition period is necessary. I am 100%. So for me personally, talking about Q, Swadik Mayanja, Medicare for All is my litmus test. That is my number one litmus test. I think life, liberty, and the pursuit of happiness, right? Life is first. Life is first. It is important. I think Medicare. I think healthcare should be a right to all citizens. It should not be only for the rich and the privileged. Thank you guys so much for watching. I really do appreciate this. If you guys were informed or educated in any way, shape, or form by these stories, please hit that like button. If you liked my presentation of the news, I really suggest you subscribe and hit the notification bell so you know every time Q the Nurse drops some hot, fresh press news. Thank you. Deuces.